Welcome everyone to today's webinar. I am Leo Vardarella with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. We are thrilled to have Maria Labruto from eVariant here to moderate today's practice session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Alexa Warner is a graduate of Randolph-Macon College, where she double majored in economics/business and nonprofit management. She then went on to earn her Master of Health Administration from Virginia Commonwealth University. Upon the completion of her MHA, Alexa joined the administrative team at VCU.Health, the region's only academic medical center, to complete an administrative fellowship. Post-fellowship, Alexa transitioned from hospital operations to strategy and marketing. Alexa currently serves as the manager for the Department of Strategy and Marketing at VCU.Health. In her role, she manages various system-level initiatives, including the implementation and management of both customer relations management and physician relationship management solutions. Additionally, she leads a team focused on service line management, enterprise communications, corporate sponsorship, strategic growth programs, and brand governance. In the community, Alexa sits on the board of directors for both Crossover Healthcare Ministries and the Virginia chapter of the American College of Healthcare Executives. David Roth serves as the Vice President of Product Marketing for eVariant. With more than 2 decades of experience in the enterprise healthcare software industry, David provides product strategy and industry support to eVariant that ultimately enables health systems to optimize growth through smarter patient acquisition and retention. Before eVariant, David served in senior roles at Healthcare Source and Kronos in product marketing, sales operations, consulting, and business development leadership. David led cross-functional teams that helped clients achieve tangible business value through in-depth assessment, business case development, and world-class enterprise software technology deployments. Additionally, David graduated from the University of New Haven, where he completed his master's degree in computer science and bachelor's degree in mechanical engineering with honors and the university's presidential scholarship. Aaron Dyer is an executive vice president at Envera and leader of growth, overseeing business development, marketing, and client success for the company's multifaceted engagement solutions. Before joining Envera, she served as a corporate vice president in corporate communications, marketing and outreach at Carolinas Healthcare System. Previously, she served as director of corporate communications for the Cleveland Clinic. Aaron graduated with honors from Case Western Reserve University with a BA in psychology and sociology. She earned an MEd in education, counseling, and human behavior at Vanderbilt University and recently earned her executive MBA at Northwestern University Kellogg School of Management. David, I'll now turn the floor over to you.
Great, thanks, and thank you everyone for joining the call this afternoon. I'd like to just kind of walk you through the agenda. We're gonna have introductions by each one, so that you're familiar with VCU, eVariant, and Envera. We're going to take a moment to talk about today's healthcare consumer, the case for healthcare CRM, highlight access centers, and discuss about our new customer journey these days. Most of this will be shared by Alexa, so we understand her real world experience, and she'll wrap it up with results and realities. Alexa will highlight what VCU.Health set out to do and the people, process, and technologies that came together to make it happen. And I will pass it on to Erin to introduce Alexa.
Thanks, David, and hello, everybody. Welcome back from the long Memorial Day weekend. And yes, as we just said in the agenda, we outlined the ultimate goal for today was to share our successes as well as our lessons learned. Alexa has put together a pretty amazing strategy at VCU, and we hope that what we all get out of today's call is lots of ideas of how we can engage our consumers moving forward. And I will pass it on to Alexa to start the story.
Thank you, Erin. So hello, everyone. Excited to be on the call today to share a little bit about what we've been up to at VCU.Health the last few years. Just a little bit about our organization. VCU.Health is comprised of an academic medical center located in downtown Richmond, Virginia. We also have an acute care a critical access hospital in South Hill, Virginia, and we have a children's hospital within our hospital in downtown Richmond. We also have a practice plan that has over 800 physicians. We also have over 800 licensed acute care beds. Like any large AMC, we have thousands of inpatient discharges every year, as well as thousands of clinic visits. We currently have about 23% of the share in the Metro Richmond market area, but hope to see that grow in the coming years with our CRM strategy. I'm going to hand it over to Aaron, toss it back to share a little bit about Envera, and then Dave to talk about Avariant, and then we'll dive in.
Thanks so much, Alexa. So Envera.Health, I'm proud to describe as an engagement services company. Our sole focus is creating a better experience for patients. We do partner directly with health systems, and we are focused on how health systems engage their consumers. The company is based in Richmond, Virginia, and we are right in downtown Virginia along the beautiful James River. A big area of focus for Envera.Health comes from 15 plus years of my experiences in engaging consumers on the provider side. I am a founding member of the company and have been there since the beginning. And we spend almost all of our time, pretty much all of our time, enabling our people. You know, we do run an omni-channel experience, so we believe that individuals need engaged on several levels. Meeting them where they are is critical. So we enable our agents in our engagement center. We are a services company, so our people are our solution, and we provide them with a holistic view of the consumer. So the interactions that they have with consumers make each patient feel engaged, connected, and personally enabled by the health system that we support. And making every single moment with that health system matter is what we exist for. I'll pass it on to Avariant. Dave.
Thank you, Erin. Folks, eVariant is proud to provide the healthcare's only Patients for Life platform. We've partnered with Envera to offer next-generation engagement services to deliver a more integrated, personalized patient experience. And so what is eVariant all about? On the right-hand side, our customers achieve indisputable value through high-value service line growth, improving provider network utilization and planning, and extending patient lifetime value. Our solutions, which you can see in the middle, deliver actionable intelligence that enable healthcare providers to find, guide, and keep patients for life. And eVariant is trusted advisor to leading healthcare systems representing over 1,000 hospitals nationwide. And next slide. Alexa, I believe this is over to you to talk about today's healthcare landscape.
Great, thank you. So I guess I want to say, you know, that all sounds fantastic, but then there's this reality of kind of what we're living in. I think some of these screen grabs that you all are looking at are not unfamiliar to you, and I think that some of the things that have just rolled out with Amazon and Apple and the things that are happening with Berkshire Hathaway and JP Morgan Chase, it's just going to keep coming. And these things have clearly been in the works for years, and we're just now learning of them. And I think the question we all have is, at least in academic healthcare, is, you know, what does that mean for us? As an AMC, we're kind of the behemoth, really. We're the most expensive option, and we're a little bit antiquated in the way that we're set up. But that said, there's still a really important place for the highly subspecialized care that we provide in our communities. And so the challenge is to figure out, how do we meet patients as consumer kind of where they are? Everyone wants to be touched in a personalized way. I think as Amazons and Netflix and the Googles of the world just become kind of more like public utilities than kind of the icing on the cake, it's becoming the expectation. And so we're having to innovate at, you know, what feels like lightning warp speed when, you know, we should have been at this table 20 years ago. So we're really trying to catch up. So I will kick this over to Aaron to talk about the truth of all that. And I am not here to talk doom and gloom. I think we just want to be real about the world that we're living in. And then, like we said in the tee up, kind of talk through how we're kind of tackling some of those really real issues.
So thanks, Alexa. And, you know, I think exactly what you're describing with their challenges, challenges all the providers in the country are experiencing today. This is a lightning fast, sort of IT software-led world today, and consumers are becoming more and more acclimated to the real-time access that they do get, and the superior experience that they get. So for everybody on the phone who probably ordered something from Memorial Day weekend or after the holiday from Amazon, what that experience feels like. And unfortunately, I think we also all have lived in our provider world for a long time, and we know what that experience feels like, even as a patient. And it's not as accessible all the time. It's not as responsive and not as consumer friendly or service oriented as perhaps our consumers of today and now of tomorrow expect from everything that they interact with. The truth is the primary reason that we believe that we can change the way healthcare engages with consumers, when the truth is efficient, effective, and delightful experiences. This slide really is just saying that 40% of consumers say they trust retailers like Walmart or Target to manage their health. And so again, what Alexa was describing is sort of the urgency behind the provider space, and as Alexa said, we believe the providers are the only ones in the driver's seat to change these experiences. You are the last place that touches the consumer and their health and engages with them. So really ensuring that they have everything that they experience in the rest of their consumer world is at your fingertips on the provider side to deliver their health care.
Right, so Erin, to kind of extend that even further, right, what we're seeing is that the battle for acquiring that consumer is on like never before, right? So today's healthcare consumer just has more choices than ever. While that's good for the consumer, it places additional pressure on the system to compete. So there are, number one, new front doors opening every day, right? So everyone's familiar with telehealth, the emergence of telehealth and where it's advancing. Amazon, Walgreens, others in this space. CVS and Aetna looking to merge. CVS and Aetna alone, provided all things move forward, will open up 10,000, I believe, new retail locations and access for today's healthcare consumer. Added to that, health systems, as they each strive to grow within their own space, geographically or otherwise, are crowding, and they're facing stiffer competition for key services they provide from one another. And last, consumers themselves are doing their own research, their own diagnosis, if you will, and consumers are relying on Dr. Google for their health advice. I think I read somewhere that on average, 1 out of every 20 searches that are done on Google are related to healthcare. So all these choices mean more pressure on today's health system to carefully acquire patients among all these different options, and that's challenging their ability to grow. So, but acquiring is only half the challenge, and some would say the bigger opportunity for growth is retaining new and existing patients. Right, and we see that first of all, loyalty is key to driving profitability, right? And that's why we're so focused on experience, right? So it is 5 to 10 times costlier to acquire than retain patients. So to do things very efficiently requires retaining once that patient is acquired. And also, what's advantageous is just 5% increase in retention, according to a survey done by Bain, increases profit by at least 25%. I think the range is even as high as 95%. However, loyalty is declining. Here we see that loyalty is declining by as much as 20 to 50% attrition. And so, what's interesting is we expect loyalty from boomers, edge generation, millennials. Not surprising to see that their attrition is 43% or leakage of them. But what's probably more alarming is that the Gen Xers, those right in the heart of things, are 44% likely to decline in their loyalty. And then and hospitals are also at a disadvantage compared to retailers that they're competing against in the space. And studies have shown that the average patient, for example, visits a retailer 26 times a year, as opposed to just 3 times a year where they see their doctor. So obviously hospitals are at disadvantage to these retailers because of the high degree of touch that they're able to achieve. So once again, all this is going on in order to better acquire and retain consumers as a focus.
So
Alexa.
let's talk a little bit about the current state. I don't think it's a secret that it's unsynchronized at best. Traditionally, healthcare providers, we're not known as big systems for our savvy skills in customer service. I think that we've all seen that shift in recent years as the trend for chief experience officers has come online, and I think we're all still figuring out what does that really mean, and in the conversation of shifting to value-based purchasing, is that really happening? Is that coming? I'm sure you guys are sitting at your computer screens shaking your head in agreement. Everything that we have in this space that you see on this slide is very separate. It can be distinct. It can be very department specific. We joke at VCU.Health that these are our silos of excellence. And we burden the patient with how all of our operations work. At VCU.Health system, several years ago, we brought in Disney Institute to kind of work with our teams on developing our own internal customer service initiative, if you will, that we call Star Service. And one of the big takeaways that I think translates quite well to the work that we do with CRM is the idea of kind of the front stage and the behind the scenes. And I think that we need to get better at hiding and shielding our patients from the silos that we do live in. And Aaron's going to talk a little bit about the way that we do that from a call center perspective with really unifying and centralizing our front door. Because of all this, we miss opportunities, we feel, to positively impact perceptions, to connect people to the appropriate care, and to just do the right thing for our patients. I'm sure many of you that are on the call are also patients in the health systems that you work in. So secret shopping happens every day, all day, especially when you add kids and husbands and elderly relatives to the mix. And we start to see that, this is really tricky. And for me as a marketer, and I feel strongly that our team, we really shouldn't be preaching any good news unless we can really back it up. And so that's kind of where we're going to go with this, is talk about how our team has kind of really flipped the conversation. I'm sure many of you felt like, marketing doesn't have any control over the patient experience. And today we really want to challenge that, not necessarily in the outward facing work that we do and how that's connected to other departments within, but as well as kind of connecting behind the scenes to unify this front door. And it is certainly tricky. So Aaron, I'm going to pass it over to you to talk about this next truth.
Thanks, Alexa. And I think you've pretty much summed it up on this truth, the way you just described it, and the way I think all of us have experienced it as patients of our own, and that we're unsatisfied with the experience. And today consumers do have a greater responsibility for their own health. More and more employers and consumers are going to high deductible plans. Their co-pays are significant. And the burden of cost is more on them. And for them, they're becoming, savvy consumers. They're really starting to understand how charges are made and how costs are managed and how their healthcare costs can become a somewhat unpredictable portion of their budget. And so it's no wonder if they do decide to make the choices to utilize healthcare, that they want a superior experience when they do. So if we kind of move to the next slide, I think something that Dave said earlier too, which I know resonates at VCU, and Alexa, we've talked a lot about this, and it's really about that front door. It's really about if you want to maintain loyalty, if you want to maintain a committed, connected experience with your consumer, regardless of their level of health, that you really have to respond to them as they're starting to expect responsiveness in the rest of our industries around us, especially when it comes to access and convenience. So as the truth I showed earlier, around 40% of them trusting retailers, and retailers having 26 times a year exposure, we have to start thinking differently as providers around how can we stay as embedded in their experience as they have with other industries and other experiences. So this is just a snapshot of a study. This study was done by the advisory board a number of years ago, but it's still very, very relevant because it does show that if they can get an appointment within 30 minutes, it is one of the #1 attributes they are looking for in primary care. So potentially if they have an immediate access to the health system and they feel as though they're going to be able to be seen very quickly, they may choose the health systems over their retailers. And if they don't, how are we connecting the retailer experience to the overall experience with our health system? So the other components of this study that really just showed what's important to them is affordability and transparency. And so can they understand what their costs are, and can they really trust and believe that they're getting the full experience that they need from the provider? If you kind of go to the next slide, this takes it just one step further. All of this is showing why I used to say at Carolinas, retention was the new growth. Because for us, we have wonderful first touch experiences, and we had a lot of great new patients coming into the system. But unfortunately, keeping the patients and keeping them within their life cycle was one of our challenges. And we see why that's a challenge for all of us, and why, as Alexa said, I'm as passionate about marketing being a partner of operations and really committing to improving every touch and every moment for the consumer across the entire delivery network, because they will switch if they can get an appointment somewhere else when needed, or they will switch if they can have a more convenient location. For example, if weekend hours are available, they will pay more for them. So consumers are going to drive change for us, but really for us to drive that change together, I think we're all on the right track to getting into a more unified front door and a more unified back-end experience. So all of this is connected and seamless for them, so we can retain them. And I think, Dave, we're going to talk a little bit about an example here.
Right on. So what if we take that patient, that consumer through a journey, right? And the idea is to provide them with the ultimate experience. We're going to take a look here back at recall John, who was I think in the red shirt earlier. Let's take a look at an example of what it means when, for example, when targeted digital marketing, informed call center agents, and physicians are all working together in conjunction for the sake of the system and the consumer. So John's a 30-something dad. He's been nursing an old college knee injury, right, that just won't go away. So John receives an email recently on the topic. John recognizes an ad for fictitious Lifeside Hospital's Joint Replacement Center while he's scrolling through Facebook, which, by the way, is a result of strong digital presence and targeting by Lifeside's marketing team. So John clicks an 800 number in the ad, which directs to Lifeside's call center. Susan, the call center rep, knows John's responding to the joint replacement ad by virtue of a number dialed, and a page with John's information automatically populates based on matching his cell phone number. And further, a script to his weekend warrior persona, if you will, is made available to Susan. So with this information, Susan can query orthopedists located near John's office and schedules an appointment. And this triggers a text confirmation and later an appointment reminder to be sent via John's preferred channel, whatever that be. Susan also notices that John's daughter missed her last appointment, and at John's request, she sends recommendations for pediatricians that accept the family's new insurance. Now, a few days later, John's invited to a seminar on joint replacement that Lifeside is hosting. He's further pleased to receive a a reminder to schedule his daughter's physical, and John opts into the surgery and is feeling very VIP when he receives a call from Lifeside, checking on his pain, ensuring his medications were set, and proactively scheduling his first rehab appointment. So this requires everyone working together, with John at the middle with informed information, and think about what happens next, right? So if we close the loop here, when John's daughter breaks her leg playing soccer, he brings her to Lifeside. When he needs the other knee done, he uses Lifeside, and conversely, when John's overdue for his annual physical, Lifeside pings him, etc. So the journey continues, following similar patterns with next clinical needs and episodes of patient and household. So that's just kind of a story around what can be done that should resonate with everyone.
So I think we can all agree that that is an ideal patient journey. And the patient journey, there is a range from, the simple primary care patient journey all the way to, a complex patient with multiple comorbid conditions, with surgeries and readmissions. And I think that what we've learned over the last several years is that, the opportunity to use technology like this and services like this allow us to potentially manage that patient from kind of the lower end of the range all the way to the higher end of the range, and for them to feel like they are known to us along the way. So that's this idea here, is starting with the customer experience and working backward toward the technology. Totally ripped that off from Steve Jobs, but if it isn't broke, don't fix it, right? So our goal today was really, and is to explain to you how the three of us became partners. And so just some real quick context for all of you, and then I'll go through our goals. We began partnering with a variant back in 2015. We signed our contract and began our implementation. We implemented the product officially in June of 2016, and we've been live ever since then. We've run a little over a dozen campaigns, ranging in size from kind of the full-on multiple, landing page, multiple calls to action, multiple web forms, which we'll talk about momentarily, down to, just a phone call reminder campaign. So we started that journey with a variant, and we were on that journey just with a variant for about 2 years. And so, this process is very organic, it's very iterative, and this technology is kind of morphing all the time, and as I know you all have experienced. And so kind of at the 2-year mark, we realized that the data that we were getting through our CRM for return on investment was only part of the picture. We realized that we had failed to connect appropriately with our call center complement, and kind of naively thought that we would be able to capture that information in a different way outside of the automation of our CRM. And so quickly we went, kind of retraced our steps and went back to our call center leadership, which in our organization sits within revenue cycle for patient access services. And, they were all about it. They get it. They understand why, we need that information to kind of close our own data loop, but weren't at a place where they could partner with us on that. And so kind of got the green light to look outside of our organization to partner with a company that could provide us that marketing call center support. So Entree and Vera, and we began partnering with them back in October of 2017, and have launched several campaigns in conjunction with a variant to date, and we're beginning to see the benefits of that. So in terms of our goals, obviously, like we said, it was to improve this patient experience. We definitely wanted to track ROI on our marketing dollar, which they said in the intro, I came from an operations background, and so I, in the very beginning, kind of really rolled my eyes when I heard ROI and marketing in the same sentence, but have since been converted. We use propensity modeling to target, which we'll talk a little bit about. Our goal is not just to drive volume, but it is to support that patient retention piece. And that's just kind of critical to who we are as an organization. It's embedded within our mission. I'm sure that some of our competitors in the region might have a different goal slide, But I think that with any work like this, it's important to kind of stay true to who you are as an institution. If you want to go to the next slide, Dave. Okay, so I want to share this little anecdote because I think it's kind of critical to this idea here. And so we were at a meeting, our team, marketing, was at a meeting with our call center teams and our chief information officer. And she's been here for about 18 months. And she said that she was just sick of, this trend of bringing in all the latest, greatest technology and then looking for a problem to fix with it. And that we've, as an industry, really gotten ourselves in trouble with that line of thinking. And so her comment was, let's just kind of cut it with all this cool technology and let's just fix our problems. So she's, in partnership with us, undergoing a system-wide audit of all of our platforms, all of our agency partners, all of our vendor partners that provide us technology to fix issues that maybe don't exist. And so what we've seen is that the work that we're doing with Invariant and Envera has kind of bubbled to the surface as a critical thing that needs to stay. It can be a system tool, and the fact that we've started with marketing, allowed us to show some quicker wins and some successes that we are now able to kind of extrapolate and share across the institution. And so kind of where we are today is, while this is fancy and fun, it's not going anywhere. And it has become critical to the work that we do at VCU.Health. Dave, do you want to take the next one? And then we can jump back to kind of where we've been.
Yeah, thanks, Alexa. Right, so, what's involved, I won't go through all of these necessarily in detail, but to support this agile, high-yielding marketing machine from a healthcare CRM standpoint, it requires an end-to-end solution, right? So with a wealth of intelligence that fuels market analysis and exploration, list building helps turn that exploration into actionable intelligence. This is all supported by multi-channel campaign creation and execution. Bottom left, marketing automation is key to the strategy, really nurturing consumers into patients, as well as engaging patients before, during, and after a care episode. Upper right, lead management tools are required, including web form and event management tools, and no longer waiting, right, to see how a campaign's performed 3, 6, 12 months later. Near real-time reporting on all aspects of the campaign allows you to optimize the minute you press go on a campaign. And this detailed reporting ensures budgets are maximized, and you can demonstrate and communicate, to the point made earlier, actual impact to the bottom line. So this is made possible when this CRM is at the hub of a greater ecosystem of tools and data that supports the growth efforts. On to process and strategy.
Yeah, so absolutely, Dave. I think at a high level, that's a really good outline of where we are. What I want to impart upon you all today is kind of what it takes behind the scenes to get there. It is very challenging. And I think kind of that's when working with your agency partner to figure out kind of the environment that you're working in and pulling in best practices from other organizations and kind of learning from their mistakes instead of, making them yourself. But behind the scenes, we look for 3 main things when we're deciding what types of campaigns to do. We look for things that, in theory have been deemed an institutional priority. We look for things that are driven by consumer choice. And then we look for areas that have real access and low wait times. And that can depend based on the type of service that we're talking about. So in our market, dermatology, an 8-week wait time is actually really great. So, it's working with the account team that reports to me to make sure that they're really up on our market trends so that we don't shut down, ideas as they come forward because they're not hitting this 2-week time limit. Behind the scenes, we've spent a lot of time working with our service line managers, arming them with kind of this discovery question toolkit that they sit down and work with our requesters on what we need to know to develop a successful campaign. And so campaigns are identified in 2 main ways. So they're either brought to our attention, you all are familiar with the squeaky wheel, or we are working with our business intelligence teams to figure out what we need to be focusing on in the coming years and try to work that around our annual marketing plan. And so in those two ways, those conversations kind of unfold a little bit differently, but essentially the goal is to get to, does this make sense to be a digitally focused CRM campaign? And part of that work has really been educating our environment on, just because it doesn't make sense for CRM doesn't mean that it's not going to be supported in our other, earned, owned, and paid channels. This is just kind of a really strong tool in our toolkit. So I would say if I had to break it down, 20% of the work is kind of what Dave described, and like 80% of it is this operational work on the front end to make sure that a campaign is ready. And so once we get to that readiness assessment, that's when we're then plugging in our agency partners to develop all of the creative, the landing pages, figuring out the right calls to action, identifying the right demographics. We're working with a variant who also buys our media to determine the correct PPC builds. And then we work closely with Envera to figure out these call flows. And so for many of you, I'm sure you live in a similar environment as we do, in that, not all of our calls are centrally managed in our call center. So Erin and her team have really jumped in, and each campaign so far has been a little bit different. And so that's really great information that we're then able to, manage up our chain to say, we need to get to a place of, more consistency across the board, because that, like we said, impacts the patient experience. And then we get to this place where you can kind of take this progression, this linear progression, and kind of spin this into a loop where it doesn't really stop and it doesn't really start. It just is continuous. And so that's kind of where we are. And I hope that at the end, if you guys have questions about that, we can dive a little bit more into that, because that is definitely the biggest takeaway that I think our team has had in the last 3 years. So jumping into CRM campaign components, just to kind of talk about what I just referenced. We kind of call them our full Monty campaigns, when they've got this big landing page, multiple calls to action, multiple web forms to drive that CRM patient journey. Calls to action are, call to make an appointment, to download this guide. It's never going to be, click here to learn more. Over the last few years, we've kind of dabbled with which partners make these pages. Do we do them in-house? Do we outsource them? And I think we're definitely still learning along the way. But our goal was to kind of start big so that we could learn how to do this in a big way, and then we could get to a place where it was scalable, and we could be a bit more nimble in getting more campaigns out in market at any given time. So I think that when I go back to what I was saying earlier about the web forms are a critical component to any CRM campaign, but we know that 68% of consumers still want to pick up the phone. Emails, texts, chats, messages, they're all great, but I don't know about you, but I mean, I'm a millennial, and I still just, sometimes it's just too much, and I just want a phone number to call. And so we want to make sure that we're capturing, the estimated 50 to 75% of interactions that are coming through our campaigns in this life cycle. We want to make sure that we're engaging our patient base in these other ways, but that we're still available. So Erin, if you want to take the ball on that, you guys are certainly the experts there and have really helped us to optimize that piece of our campaign strategy.
Sure. And, Alexa, you've said so many important things to what I think all of us are addressing in our challenges and engaging with consumers. And, I've heard so much from my peers around the country around establishment of their, digital front doors, and the importance of the virtual connection vis-a-vis online scheduling and text, email, reminder systems. And those are all important. And as we said at the beginning, we want to meet consumers where they are. And every individual is different and unique. And so where we wanted to build out in our strategy, and that's why we don't call ourselves a call center, we call ourselves an engagement center, because it's not just about the phones. It's really about communication and human beings that are there and prepared to interact with other human beings when they need it. So the creation of the omni-channel experience really is what we try to build around all of the hard work that Alexa just described, the 80% of the workflow that you have to create when you're talking about every detail of every moment when you're trying to interact with a consumer. When will they want to interact with you? How will they want to interact with you? How can we best be prepared to manage that interaction? Is really the experience, and we talked through one of those examples in that journey map, but that is what we try to do, and we try to do the very, very hard work to ensure that we're covered in any way, shape, or form that a consumer wants to engage. We aren't really set up for that. Even as Alexa referenced in the silos, it is our silos of care. We do not connect technically all the time in a way a consumer wants to engage vis-a-vis primary care versus pediatric care versus orthopedics and rehab and say heart care. So really creating an omni-channel experience and a full view of what a consumer has been through and is going to go through with the healthcare system is the goal. And if you go down, Dave, to one more slide, it takes collaboration. Not one thing extracted from another is going to solve this issue. So you can't just put people at it without processes. You can't just establish a workflow without fully resourcing it. And technology alone and digital is not going to solve 100% of an omni-channel experience that consumers are expecting today. So really what we're looking for in the future state is truly a collaborative approach to people, process, and technology, and I love the story that you stated with your CIO, Alexa, not just buying technology and seeing if that'll solve your problem, because these are point solutions that need integrated into a process. And, we often talk about, the services that we provide as more of a workflow company than anything else, because we probably spend 90% of our time when we engage with our partners on going through the workflows, making sure nothing's been missed, and ensuring that at every touch, at every moment, we have covered our bases and that they will be engaged with and communicated to. Because when it really comes down to human beings, they want to have contact with other humans and they want communication. And that's really what it's going to take to create kind of positive, personalized experiences in the future state of healthcare and what we're trying to create. And Alexa, I think we are going to close the loop with you.
Yeah, so I'm going to breeze over this closed loop solution slide because I think we've kind of organically talked through this. So if Dave, you can go to the next slide. Maybe we'll go to the next slide. But for results, just want to quickly share with you before we're ready for Q&A. We've been at this now, like I said, for almost 2 years, 2 years next month. I guess 2 years Friday. We have responded to 100% of our campaign inquiries. It's not always perfect, but that was a goal of ours, and we have achieved that, and we're seeing strides there. We've certainly increased the count of prospective patients in the campaigns that we have run. With the addition of Envera to the team, we've seen 25 to 43% of conversion lifts in the first few weeks of running each campaign. We are seeing significant campaign downstream activities, and that's really resulted in kind of the way that we plan our media budget, the way that we do our annual plan for our department, and the way that we have organized ourselves as a team. Like I said earlier, a lot of the work that we've been doing has really centered on this, our leadership understanding what our role should be. I joked a couple years ago when we were in our budget defense that we weren't the art department and that we needed to be seen as a member of the operational team. And everyone's jaw kind of dropped because they think it was kind of a pretty bold statement to make, but we needed to move forward. We needed our leadership to see us as a group that they could kind of come to drive volume and to not just spend money on advertising. It wasn't until the last 5 years that we had a systems CEO that really believed in the role of healthcare marketing in our industry. And so we're kind of catching up, and so is the structure of our team. In the last 3 years, 4 years, I guess, we've grown from team 3 to 4. Now we have 13, and we're growing this year as we add new service line managers to my team to support our CRM efforts. It has changed the way that we intake requests for marketing. So it's really been a halo effect, and not all of it ends up in CRM, but it's changed the way that we ask questions. It's flipped our role from kind of being the order taker to being at the table and being a member of that operational team, and not just the senior operational team, but the clinical operational team. And that has resulted in projects that we've done that have nothing to do with CRM, that we're working on improving operations to get them to a place where they can be supported, whether it be through paid media or through earned media. Can you go to the next slide, Dave? So that all sounds great, but there's reality here, and the way this is unfolded now, hindsight, it seems very logical, but it's very challenging. Growing that team from 4 to 13 has been an uphill battle, and it has required us to roll CRM out in our organization in kind of a unique way. I'm sure some of you were on the webinar I did with Avarian back in the fall on how we did that. And we did it in an organic way. We didn't start with our leadership teams. We started at the service line level and showed success there before we kind of, like I said earlier, preached the good news. It's hard because the healthcare system, ours and just the industry, wasn't set up to manage patient communications this way. We are very much putting this very new process into a very old system that is very siloed. And it has been a lot of work, but I'll say it's been very rewarding work. And I think, when we sit around the table and we talk about, what's going well, what isn't going well, at the end of the day, we still feel like this was and will continue to be a worthwhile investment. I think you guys can read the rest of those notes, but I want to make sure we save enough time for questions. Overall, like I said, worth it. We're glad we're doing it, but it is not without its challenges. So I think with that, we will open it up for questions.
Thank you, Alexa, David, and Aaron, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. And Maria, I will now turn the floor over to you.
Great, thank you so much. Alexa and team, thank you for a wonderful presentation today. We have a few questions have come through from the audience that is on today's webinar. Alexa, question for you. How are you managing and learning from your digital campaigns at VCU.Health?
That's a great question. I definitely see our analytics as decision analytics. I think that, we have still been very conservative on making sure that when we're looking at our ROI reports, that we're then going back and validating those, the attribution with our enterprise systems. And so far, we're seeing that there is strong correlation. I think we all know that healthcare data, outpatient specifically, is really poor. So that has been, when I talk about it's been challenging, that is certainly part of the challenge, is the quality of the data isn't always the best. So then it becomes incumbent upon us to make sure that what we are capturing really is quality data. So I think we've learned a lot on the process side, and then we certainly use the information that we capture to inform, how long a campaign stays in market. Are we optimizing certain digital display ads over others? And that's a process that we undertake every 2 weeks with all of our agency partners. And so, it certainly requires a heavy lift in terms of human resources on the provider side. I could go on and on to answer that question, but those are kind of the highlights.
Okay. What would you recommend as a starting point for a marketing department that want to start CRM campaigns with minimum cost to start showing ROI to upper management? So
I think that that's actually like the fifth step in 10 steps. I think the first step is having conversations internally. It's really understanding what this technology is and what it's capable of, and then understanding what you have and what you don't have within your organization to support it. Like I said, we didn't really realize until we were, a year in that we weren't able to go back and collect that call data. So I think having the right conversations with your stakeholders up front will certainly pave the way for a clear path. And then I think once you get there and you've all come to an agreement that that's where you're going to go and that CRM makes sense for you, I think it's being really picky with what you choose to work on first. And so kind of refining that intake process and figuring out operationally what the appetite is at your institution, whether that be wait time or how many leads you hope to bring in for new appointment visits. And being really real about that is key to setting yourself up for success. And then those three things I talked about earlier, making sure that what you are choosing to use CRM for is an industry priority, is something that consumers are going to shop for, and is operationally ready. And that can take a lot of time. When I look at our peer organizations that work with Avariant and Envera, I think we're kind of middle of the pack on number of campaigns launched, and it's because I personally have taken a really conservative approach on what we will put into market and making sure that it's ready. Out of the dozen plus campaigns that we've run in the last 2 years, we've only pulled one out of market for a pause to allow the service line to kind of reorient themselves and get back up to speed, which is kind of a feather in my cap because to me that shows that slow and steady really does win the race in this space.
Thank you. Question here is, what has been or is the biggest challenge for your team to getting provider buy-in to including the patient voice in their access patterns? Or how do you get them to come around to this model of service delivery?
So I don't think that that's a real issue with our individual providers. I think that when I work with our clinician chairs, with our, administrators, as teams, they get that and they want that. And, they're in the room with the patient. And I don't feel like it's a scenario where we're having to teach them that. I think where we lose traction is when you layer in our really complex organization. And then it gets hard. And then it's not really getting everyone's buy-in. It's getting everyone to kind of peek their head up out of their silo and try to get everyone to realize that to do this type of work, we're going to have to change.
Okay. This question is for Erin. How do you call reps know what campaign someone is from and when they answer the phone?
Sure. So a lot of things behind how we set up our support within campaigns, and there are some things that are uniquely different dependent on the provider and what the teams prefer. But technically, we would assign the phone number that is in the calls to action into our call center to that campaign. So the agents know when it comes up on their end as that phone number that's associated to that customer and that campaign. And then we also have the capability of, once that phone call is answered, information being shown to the agent immediately upon picking up the phone, as well as a lot of things put into our knowledge center that they can uniquely pull down, including scripts and the workflows that have been designed for that campaign. So the agents are enabled quite a bit automatically when they pick up the phone to know where that's coming from. But the technology is the phone numbers really assigned to the call to action.
Okay. And Alexa, this is for you. What percentage of marketing leads do you think come through the call center?
If I had to guess, I think about 70% in our environment. I say that because when I've looked across the system, so I'm going to use bariatrics for an example. Before Envera was on board, and we compared the ROI numbers in the Avariant platform with our enterprise analytics, the number was significantly lower than I knew it to be true from our enterprise data warehouse. And so, the only conclusion to draw there is that other appointments were coming through the calls. We are, hopefully we'll be back in a year talking about what we've seen. And Vera's been involved with that campaign now for 3 or 4 months, Aaron. So I think we're still yet to see the true impact. But I feel strongly that it's there, and I'm looking forward to being able to report out on that.
Yeah. Hey, Alexa, it's Dave. If I can add that we have other clients that have been tracking that, and we see that up as high as 75 to 80%, and I think that supports the statistic that was earlier on in the presentation. I do want to add just one point briefly as it relates to getting providers on board. We had an interesting story with one of our clients where they made the move to digital marketing. And really drove activity over a key service, and then they turned that campaign off. And I forget the doctor's name, known internally at eVariant as Dr. N. Dr. N actually yelled down to the head of marketing one day and said, "Hey, where did all the patients go? I heard you turned off the digital marketing campaigns. Please turn it back on." So, at the surgeon and provider level, they noticed a change to when actually they had stopped doing running their marketing campaigns. So we are making believers out of some of the providers real time, and we hear about it. So great story. I just wish I could remember mine.
I want to add a little bit more to that, if it's okay.
Yep.
We had a very similar experience with our first run of bariatrics. And so I go back to our strategy and how we rolled this out, and why I'm saying that it's not an issue in our institution. I think it's because of the way that we rolled out. We started with bariatrics, where we knew we had significant capacity to steal and add share in that space, market share. And so just a little anecdote, our chair of bariatric surgery in the year prior to running the CRM, he did 19 total surgeries. So kind of low, but he's the chair, so he's doing other clinical things, or administrative things rather. The bariatrics campaign ran for a total of 3 months. It ran from September to like mid-December. In January of that year, he did 19 surgeries in 1 month. So while we weren't seeing that ROI come through the attributions yet, like we were hearing from the team that this was amazing. And so that following March, when we went to go put together our marketing budget for the year, we have a June to July fiscal year, he asked for a meeting with us, and he came prepared with all these reports to show us how successful it had been and why we needed to relaunch it. And, about 10 minutes in, we kind of said, okay, I think you're mistaken. Like, we're good. We're all on the same page. We agree with you. We are going to ask for more funds to put this back in market. And with that anecdote, we were able to add a very significant number to our overall budget for the following year, which has allowed us to launch many more campaigns than we had hoped. So I think in our case, starting with the clinicians, they talk to each other. And so getting them to buy in and understand it hasn't been a problem for us. And while that was a risk, I think, to go about it that way, it's really worked for us in the long run.
Great, thank you so much. Looks like we're at the top of the hour here. I'm going to go ahead and pass it over to Leo. Thank you for everyone that joined today's webinar, and thank you to our speakers.
That is all the time we have for today. I want to thank Alexa, David, and Aaron for their excellent presentation, and eVariant and VCU.Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.